Okay. Well, hello, everybody. Thank you so much for joining. I'm Linda Nellis. I'm the Alumni Services and Engagement Coordinator at the Daniello Institute for Veterans and Military Families. Welcome to today's VetNet, Empowering Veterans, Mental Health Awareness and Support Resources. Today, you'll hear from IVMF's Community Services Program Manager, Erin Milius, Caitlin Treadway, Community Engagement and Partnership Coordinator with the Syracuse VA Medical Center, and Stephen Lockwood, Veterans Outreach Program Specialist with the Syracuse Vet Center. They're going to each provide overviews of their respective services and roles. And following the presentations, IVMF's Alumni Services and Engagement Manager, Cassandra Rosica, will lead a live Q&A where you'll be able to get your questions answered by these experts in the field. So at this time, I'm going to hand it over to Caitlin, and you can go ahead and share your screen.
All right, thank you, Linda. Can you all hear me and see my screen? Perfect.
Yes.
Thank you. All right. I'm just trying to figure it out. Okay. Well, good afternoon, everyone. Thank you for having me today. I wanted to take a minute to introduce myself and my role to all of you. My name is Caitlin Treadway. I'm a licensed mental health counselor by trade, and I am one of two community engagement and partnership coordinators, or CEPC for short, because we know VA loves acronyms, with the suicide prevention team at the Syracuse VA. You can find at least one CEPC in all VA medical centers across the country and in our territories as well. Our role, if you're not already aware, it's an extension of the VA's 2.0 suicide prevention efforts. We work from a public health perspective, engaging with all veterans, especially non-VA connected veterans, in the community, their families, veteran serving stakeholders, and other individuals and organizations connected with veterans. We work with coalitions, grassroots organizations, community-based organizations, and more to support their efforts and to provide any assistance they would find helpful to further their suicide prevention efforts. The aim of these efforts is reducing death by suicide in the veteran population among the entire veteran population, regardless of where they receive their care. Our work is focused around 6 main priority areas: identifying veteran service members and their families, screening for suicide risk, promoting connectedness, improving care transitions, and increasing lethal means safety and safety planning. So today I'm going to provide an overview of VA mental health services, discuss what mental health services are offered at VA, discuss how to get connected with those services if you're interested, and then provide resources that you're able to utilize. So just an overview of VA mental health services. The U.S. Department of Veterans Affairs aims to address veterans' needs from the moment they transition out of the military through their reintegration into civilian life and beyond that. Overall health includes mental well-being, and if you need support for specific mental health problems, or you're having trouble sleeping and controlling your anger, or just readjusting to civilian life, you're not alone, and we can help with that. Over 1.7 million veterans received mental health services at the VA last year. Our services range from peer support with other veterans to counseling, therapy, medication, or a combination of all of those. Our goal is to help you take charge of your treatment and live a full and meaningful life. The VA's mental health program and services are rooted in several core values. So a focus on recovery, whether a veteran is facing a mental health concern, substance misuse, the effects of military sexual trauma, or any of life's challenges, focusing on healing and recovery empowers them to take charge and live a fuller and meaningful life. This approach builds on a veteran's strength and offers respect, honor, and hope to both the veteran and the family members who support them. The second one is evidence-based treatments. They are those that have proved effective for a particular mental health condition. These scientific tested courses of treatment include a range of therapies and medications. At VA, evidence-based treatments are tailored to each veteran's needs, priorities, values, and preferences and goals. Many may work quickly, sometimes within a few weeks or a month, depending on the nature or the severity of the symptoms. The third is measurement-based care. So this provides veterans the opportunity to take an active role in their mental health care. In measurement-based care, the veteran is part of their own treatment team, working with their providers to set recovery goals, develop treatment plans, establish benchmarks, and monitor their progress. The treatment's tailored to be individual to the veteran's specific needs, and metrics gathered along the way are used to determine whether the treatment is working or if adjustment needs to be done. VA is working to ensure that measurement-based care is part of every one of its mental health programs as well. And we'll talk a little bit more about those programs as well. Coordinated care for the whole health, for the whole person. So timely medical care, good nutrition, regular exercise, a sense of purpose, and supportive family members and friends are just as important to mental health as they are to physical health. That's why VA healthcare professionals work together to provide a safe and effective treatment for the whole person, head to toe, inside and out, using what's known as a whole health approach. So through VA Whole Health, veterans take an active role in their care by partnering with their providers to achieve and maintain their optimal health and well-being. And it all starts with answering a simple question: what matters most to you? Number 5 is round-the-clock service. Emergency mental health care is available 24 hours a day, 7 days a week at VA medical centers. Facilities that don't have a 24-hour emergency room provide these services through a local non-VA hospital. Telephone evaluations at VA medical centers and the Veterans Crisis Line are also available around the clock every day. And we're going to talk more about those as well. Number 6 is peer specialists who are trained and certified in offering mental health support. As veterans themselves with personal experience of recovery from mental health conditions, they help other veterans identify and achieve specific recovery and wellness goals. Peer specialists are found in many types of VHA settings and can provide support in several different ways, including serving as a role model by sharing their recovery stories, collaborating with healthcare professionals to support a veteran's goals, helping veterans develop and enhance problem-solving skills, helping veterans identify their strengths, their skills, and resources needed to achieve their goals, empowering veterans to speak about their mental health concerns, and informing veterans about available VA and community resources to them. And the last is care close to home. So improving veterans' access to care. So VA is adding more rural and mobile clinics and working with healthcare providers in smaller communities. VA also uses cutting-edge technology, including mental health care by phone or secure video, self-directed apps for smartphones, and we'll talk a little bit more about those as well, and text-based support to deliver care to veterans when they need it, wherever they are, even in the comfort of their homes. Michael, I see that your hand's up. I think if everyone's okay with it, I'm happy to, if you ask your question now, or we can wait until the end, whatever everyone's preference is. Go ahead, Michael.
Michael, I think you're muted.
I can't hear you. If you want to type your question in the chat, I'm happy to answer it after the presentation, if that's helpful. Okay. All right, so moving on, these are outpatient mental health services offered. So I just wanted to let you know that these services may look somewhat different depending on the facility that you're receiving care at. But this gives you an overall idea of the mental health services that are offered through the VA. So caregiver support, we're going to talk a little bit more about that a little bit later on when we talk about resources. Couples and families counseling, healthcare for homeless veterans. So if you or you know of someone who is homeless or unstably housed, we have a program for that. Interpersonal violence program for individuals who are experiencing interpersonal violence. M2VA, so our military to VA programs, you may be familiar with the OAF program. But this is the first program that veterans who have just transitioned from their time in service will experience. Their first appointments in the VA will be with this program, and they provide that initial primary care support and also mental health support, case management for those newly transitioned veterans. Mental health intensive case management, or MHICM. This is a program for our veterans who have special mental health needs. Outpatient mental health therapy and medication management. Primary care mental health integration, or PCMHI, that is mental health providers integrated into all of our primary care clinics. Psychosocial Rehabilitation Recovery Center, PRRC. This has specific diagnostic criteria, but those it's more of a collaborative social support network and groups. They also provide individual therapy as well. Our PTSD clinical team, or PCT, they provide evidence-based therapies for PTSD. Substance treatment services, or STS. Suicide prevention. So these are the individuals that follow up on any of the crisis line calls that we receive within our 13 county catchment area, and every VA medical center does have a suicide prevention team. Additionally to that, they provide short-term therapy and case management services to our veterans who are assessed as high acute risk for suicide. Veterans Justice Outreach, for those veterans who are have criminal charges pending or are involved with our legal system, we have a program that can help assist them. And also vocational rehabilitation. So those individuals who are interested in pursuing careers or work placement, and also education as well. So inpatient mental health services offered. Again, this may look different facility to facility, but care can be coordinated as appropriate. So for veterans experiencing acute mental health crisis, as I already discussed a little bit, VA provides immediate access to acute inpatient mental health care through local medical centers or through the community. We also offer residential rehabilitation treatment facilities, sometimes referred to as inpatient residential or domiciliary care. This provides comprehensive treatment rehabilitation services to veterans with mental health conditions like post-traumatic stress disorder, depression, substance use disorder, etc. And you can learn more at that link there as well. And Linda, Cassandra, I'm happy to send these slides over to you as well so that people can utilize the link in the presentation. So how to get connected. So if you're already using VA medical services, ask your primary care provider to help you make an appointment with a VA mental health provider. If you're not already using VA medical services, you can contact your nearest VA medical center or vet center to talk about your needs, and you can find your nearest VA medical center, community-based outpatient clinic, or vet center at that resource locator that I linked here. So some resources that are available to you all. So the Veterans Crisis Line, if you're not familiar with the Veterans Crisis Line, it connects veterans in crisis and their families, friends with qualified caring VA responders through a confidential toll-free hotline, online chat, or text. So you can either utilize the 1-800 number 273-8255, press 1 for the crisis line, or you can utilize 988, press 1. It'll get you to the same place. There's also a chat available online, or you can send a text message to 838-255. So for those individuals in my generation, you really don't like to talk on the phone. So those chat and text options are super helpful for our younger veterans. And those are available 24 hours a day, 7 days a week, 365 days a year. So just a little background on the crisis line. It was created in 2007, branded the National Veteran Suicide Prevention Hotline. It was rebranded in 2010 as the Veterans Crisis Line. And you'll hear about it more so nowadays as the Military and Veterans Crisis Line. Essentially, the reason for the rebrandment is they didn't want veterans just calling in who are in suicidal crisis. Crisis can look different depending on who you are. And so they wanted individuals calling in if they were having trouble accessing VA care, if they had needs that weren't being met through the VA, if or outside the VA, right? And so as a way to be a point of contact for that. So there are 3 call centers for the crisis line. They are located just south of us in Canandaigua, New York. That's the original call center. There's also one out west in Topeka, Kansas, and one down south in Atlanta, Georgia. And they are all staffed by VA employees. If individuals has had a bad experience with the crisis line, I would encourage them to just try again, because each responder is different depending, on who you're talking with. Often I like to share too with the crisis line specifically is that you are able to kind of customize what you who you want to talk to in some regard. So if you'd rather talk to a female, you'd rather talk to a male, you're able to ask that. Also, if you would prefer to talk to a veteran, you're able to ask that as well, and they'll try to accommodate the best that they can. The resource locators. So again, along with that link that I put about locating a resource for you all, this helps veterans easily find VA resources in their area, including those suicide prevention teams that I talked about, crisis centers, VA medical centers, outpatient clinics, Veteran Benefit Administration offices. If they have questions about their GI Bill, or they have questions about home loans, any benefits related questions, those points of contact can answer those questions for them. And this is what it looks like. You just type in your either city, state, or your zip code within the distance, press search, and it actually pops out. And then you have the option of kind of filtering who you want the contact information for. And then it pops out phone numbers, websites located on there, addresses. And then for the coordinators, there's actually names, contact information that way as well. Make the Connection. So this is an online resource featuring hundreds of veterans telling their own personal stories of overcoming mental health challenges or solutions to issues that are affecting their lives. And you can find out more if you Google just maketheconnection.net. Don't Rate, Reach Out. So this was a campaign that was launched a few years ago during Suicide Prevention Month, and this is meant to be a one-stop shop resource for our veterans. So you can either navigate the website 2 different ways. You can either explore the resources by doing a little short survey that addresses and asks about your needs specifically, or you can browse by category. So if you're having specific problems related to a career or health challenges or money challenges, what have you, you can browse by that category. I said we were going to talk a little bit more about caregiver support. So this program supports anyone who provides care services to a veteran. So whether that is medication management, whether that's grocery shopping, whether that's helping a veteran get dressed, or they're a full-time personal care provider, anyone who provides care to a veteran enrolled in VA healthcare can participate in the caregiver support program. It's a national program that's comprised of 2 sub-programs. So there's the program of general caregiver support services, and then there's also the program of comprehensive assistance for family caregivers. And every VA facility has a local team where caregivers can access a variety of national resources while receiving tailored support from their local caregiver support team. They also have the support line as well, which is on the screen. So that's a way, and you can learn more at that website that is linked on the slide. And the last thing I have for you all is just some mental health mobile apps that are available. There's a lot of different mobile apps that the VA has. You can find more information about them on the National Center for PTSD website. There are a lot of different self-help apps. So mindfulness apps, things like that. There are also a PTSD coach app and a PTSD family coach app. So helping to explain those symptoms of PTSD, what your veteran might be going through, and then also how to have those conversations with your family, how to help them provide education to your family on what you may be going through. There's a lot of different treatment companions. So if you're going through one of those evidence-based therapies that we were talking about a little bit earlier, you can follow along through that treatment in a mobile app as well. There's also a lot of different ones on there as well. There's a safety planning app, COVID coach, couples coach, there's insomnia apps, and that just scratches the surface in regards to those. So I will stop there and thank you.
Great. So, Stephen, I think you're up next. So I will go ahead and share your presentation for you. Thank you so much, Caitlin. That was so interesting.
Yeah, absolutely. And I'll get to these questions in the chat.
Hi, can you all hear me? All right. Hi, I'm Steve Lockwood. I'm the outreach coordinator for the Syracuse Vet Center. You can go ahead and go to the next slide. So who we are. So we're located at 109 Pine Street. That's about, it's a short distance north of the Syracuse University campus. The Syracuse Vet Center is about 300 vet centers across the United States and its territories. Vet centers are part of VA healthcare, and we're what they call readjustment counseling service. And we were established in 1979. Our full-time staffing here is 8. We have 6 clinicians, an office manager, and an outreach coordinator, and that's me. We're one of the few vet centers across the nation that actually fields interns. So currently we have a psychology intern right now, and starting in August, we're going to have a social work and psychology intern as well. Our catchment area includes Onondaga, Oswego, Madison, Oneida, Cortland, Cayuga, and Seneca counties. We operate a community access point staffed by 1 counselor in Utica, New York. And the adjacent vet centers to us are Watertown to the north, Albany to the east, Binghamton to the south, and Rochester to the west. Next slide. So our services, we provide counseling services. That's what we do. We provide it for individuals, group, family counseling. It's really the veteran or service member gets with that counselor, and they come up with a kind of a plan, kind of to achieve their goals. Counseling services can be done in person, virtually, or by phone. We also provide referrals. Some of those referrals go out to the medical centers. They go to employment agencies. We work with the New York Department of Labor for employment services. We also work with the Onondaga County Veterans Service Agency. They deploy veteran service officers here on Fridays for appointments. And we also host once a month legal clinic for free legal advice and other non-criminal issues. Next slide. Our priorities. One of the big things we take seriously is our safe and confidential and privacy of our records. We do see active duty. We see people in the National Guard. We see law enforcement. We see all kinds of people, veterans and service members. And one of the things they're going to want to know is that their records are secured at our facility. We do not share our records with the VA or Department of Defense. We have experienced licensed therapists with a very low staff turnover. Many of our clinicians have worked at the VA, so they're quite experienced with working with veterans in the military. We also have easy access to services with a very simple enrollment process and very short wait times. And they're at no cost. And you don't need to enroll with the VA to get our services. We're centrally located with convenient parking. We're kind of located in the community. It's a very welcoming environment when you come into our center. We have many groups that are offered. Some of those address depression and anxiety, combat and sexual trauma, women, vets, and service members. And some of the other social groups we have include a photography group, a book club, a poetry group, and an arts and crafts group. Go ahead, next slide. So who we serve, we focus on providing services to veterans and service members who served in combat operations, areas of hostility, stateside deployments, or endured service-related trauma. Combat operations are broadly defined, but generally anyone receiving an expeditionary medal in receipt of imminent danger or a combat zone tax exclusion would be eligible for our services. We see service members who crew remotely piloted aircraft, providing military support against enemy forces overseas. So a lot of those people, those military members fly RPAs locally, and their missions are overseas. We also see Guard and Reserve members activated to provide emergency services for the COVID pandemic, and most recently, for eligibility purposes, Guard members and Reserve members who are activated for to augment staffing at state prisons are also eligible for our services. Also, another cohort of people we do see are any veteran in current use of their VA education benefits. They are eligible as long as they're using them, and if they do finish using their VA education benefits, they have 6 months to transition out of our program. And this is family eligibility. So our services are available to family members with the active participation of the eligible veteran or service member. That's important. We do not start a file on a family member or anything like that. All the services we provide to family members are in support of the veteran or service member's treatment. We also provide bereavement care. So let me just read that. So we provide bereavement services to any or hospice care at the time of their death. We also provide bereavement services to family members of any veteran or service member who have passed. Next. So we also have mobile vets. We recently had a mobile vet center. It got relocated to Binghamton. It's basically to provide veterans and service members. And also, one of the big things about them, they're used to respond to community emergencies. Recently, up in Oswego, the clinic in Oswego because its roof was about to collapse due to heavy snowfall. So the closest mobile vet centers to us right now are in the one in Rochester. Next. Vet center does maintain a call center on its own. It's different from we work together. A lot of times someone will call the Veterans Crisis Line and be forwarded after our vet center call center. So we don't have any sort of voicemail at vet centers or anything like that. that's not answered, or just say the lines are tied up, it will go to the call center. By email, they'll communicate to the entire staff about the reason for a call. And lastly, this is kind of where we get our history. Vet centers were started in 1979. Coming back from Vietnam, really didn't feel that the VA was giving them the care specifically. So basically, they got together and talked with each other and eventually started vet centers. I think about the time of their eligibility.
Yeah, Stephen, I'm so sorry. It sounds like we're having a little bit of audio difficulty. So I'm hoping everyone was able to hear as much as possible. If not, if possible, maybe we'd be able to share the slides if people would like them afterwards. But thank you so much. And let me see. Okay. All right. So Aaron, we'll see if we have a little bit better luck audio wise with your presentation.
Sounds good. I'm going to go ahead and I'm going to share my screen and then I'll get started. Thank you. Hold on one second. I'm supposed to go to slideshow. Apparently it's not. So I'm going to just share my screen. And all righty, there we go. Everyone see my screen? Everything good to go? All right, sorry about that. So my name is Aaron. I'm the program manager for the community of practice, which is part of the community services programs here at the IVMF. Before I came here, I led care coordination efforts at a program called PA Serves in Pittsburgh. And because of that experience, I have extensive working with community partners and nonprofits who provide tons of different resources in the community. Today, quick overview of the agenda. We're just going to go over what community services does in case anyone here is new to the call and doesn't sort of understand, doesn't know the portfolio of the IVMS community services. We will talk about some resources that you guys might find beneficial, and then we'll talk on how to connect to some of those resources or to our Syracuse Serves team. So really quickly, community services. Like I said, I'm the program manager of the community of practice. Essentially, there are two communities of practice that we run. One is related to organizations who do run care coordination networks throughout the United States, to include New York and Texas, North Carolina, Pittsburgh, Rhode Island. So if anyone is sort of doing care coordination for veterans in the community, we run a community of practice for that. And we also run a community practice for something I'm going to talk about here shortly, is the Staff Sergeant Fox grant, as we bring providers across the United States together to talk about best practices as it relates to care coordination and the Staff Sergeant Fox grant program. Also off of that, we do technical assistance for veterans. I mean, for those communities. So if those communities are looking to start to do care coordination, we leverage our expertise and our experience doing care coordination over the last 10 years to help them, sort of run their own care coordination communities, and also provide research, measurement, and evaluation for those communities as well as needed. And then we also have Syracuse Serves. That is all of the work we do in practice. If we were going to help all of these other communities work on care coordination, it made sense for us to have our own care coordination facility as well, helping veterans in the local counties here sort of connect to veterans resources. And like I said before, that is essentially my experience in this, as I led the efforts at PA Serves and worked with numerous nonprofits, both local to Pittsburgh and nationally as well. So with that, we're going to talk about some national resources that you guys might find beneficial as it relates to mental health and resiliency and just a renewed sense of purpose. As Caitlin and Stephen already discussed, the VA resources available for veterans in those areas, I just want to take some time to highlight some, like I would call maybe alternative therapies or techniques that veterans can use to support their own transition out of the military. I want to preface this by saying it's not about choosing one or the other. These programs are meant to be complementary to traditional treatments, and a lot of them offer mentoring, camaraderie, deeper understanding of yourself, and just a renewed sense of purpose, and help you with finding resiliency and in dealing with your mental health. So like I want to say before, this is not one of the VA or these nonprofits. They often work very complementary with one another to meet your needs for your journey in terms as it relates to finding your sense of purpose. Also, this isn't an exhaustive list, but just a way to help raise awareness of additional resources and nonprofits that exist that can offer valuable support to you during this journey. Just want to let you know that. My advice is, if you're struggling with your mental health purpose, finding connection, always begin with the VA. Or also look for any organizations that do care coordination in your communities. Those are often the best places to start when you're looking for valuable resources in your specific communities. So always be leveraging, the social workers at the VA that you come in contact with. And then if your community is fortunate enough to have a care coordination facility nearby, always leverage those as well. I will also, if you're interested in being connected to any of the programs mentioned, you can always reach out to Syracuse Serves, and I have a slide at the end that you'll be able to link to that has a link to connect if you're interested in finding anything out additionally about any of these community nonprofits. Also, I'll say is I only know what I know. So if there are any resources or programs and nonprofits that you've worked with that you're knowledgeable with or have a direct connection with, don't hesitate to ever put them in the chat and share them with the rest of the team as well. I only know so many of them, and I'm only have a certain amount of time to talk about a few, so don't hesitate to put as many in the chat as you find beneficial. So the first thing I want to start with is the Staff Sergeant Fox Suicide Prevention Grant. So the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant enables the VA to provide resources towards community-based suicide prevention efforts to meet the needs of veterans and their families through outreach, suicide prevention services, in connection to the VA and other community resources. The grants went to organizations to help identify those at risk of suicide, those that can provide case management, those that can provide peer support services, or provide non-traditional innovative approaches and treatment practices. This grant started in 2022. Not sure, the numbers are close to, I think 80 organizations received the grant funding and 40 some states are covered. So chances are, if you're here on this call, you're probably, there's an organization that serves wherever you live as it relates to suicide prevention, and they're out there. I just want to, you'll have to find those on your own or contact the VA in your area to see who is doing the suicide prevention programs in your area. But as it is a relatively new program, I just wanted to make sure it's on everybody's radar as well. And as we talk about some national resources or some national nonprofits that I've sort of come in contact with, worked with really closely, I just want to share a couple of those. I will be sharing the links with the team here, or the slides with the team here. So those links will be live whenever you receive them. So a program that I work pretty closely with is Vets for Warriors. It's a 24/7 peer mentoring hotline where you will immediately be connected to a peer who is a veteran or a member of the military community. Every conversation is 100% confidential. They're always going to be helping you find a solution for whatever it is your problem is. And they can remain connected, engaged with you as often as you feel it's appropriate for them to reach back out to you. You can set up a weekly call with them, a monthly call, whatever it is that you think is there that's best suited for you, but you can sort of cater your experience around this mentoring program. And like I said, it's 24/7 and it's valuable to you as veterans. The Wounded Warrior Project, they have a Project Odyssey. It's a mental health program for veterans that uses adventure-based learning to help their warriors with PTSD, anxiety, and depression manage and overcome, those wounds. And then essentially enhance their resiliency skills. So if it's something that you're looking for, they do things whether it's all male, all female, co-ed, family groups, or couples programs, all associated with, with their Project Odyssey. Some other programs that I've worked with pretty closely are Boulder Crest, and essentially they focused on something called post-traumatic growth. It's the first training program to teach our nation's combat veterans to experience lifelong post-traumatic growth. The goal is to create sustained transformation. It's a 90-day non-pharmaceutical peer-delivered training program that begins with a 7-day intensive and immersive initiation, followed by 3 months of dedicated support, training, and accountability, and connection to their team of well-trained doctors and other combat veterans. Another one that I've worked closely with is Warriors in Quiet Waters. These help veterans find deeper connections to themselves and through their purpose. They have 3 tracks, including fly fishing, hunting, and photography. And it also has programs for couples as well. It's another way to sort of immerse yourself, find purpose, and gives you some different tracks, including fly fishing, hunting, and photography, as sort of tracks for you as the veteran to find purpose after your transition or through your transition. Another one would be Outward Bound for Veterans. They offer wilderness expeditions specifically designed for veterans programs that are designed to be exhilarating, challenging, and rewarding. So a lot of these things are, adventure-based programs or outdoor-based programs. I just wanted to make sure that a lot of you guys are familiar with these programs to help you with your transition. Another additional therapies that I'm pretty sure you guys were all aware of, but I just wanted to make sure that we talk about anyway. Equine therapy or service pets and animal type therapies. I've been fortunate enough to engage with a few of the equine therapies, both locally in Pittsburgh and nationally in Dallas, and found them extremely fascinating. And there's a lot of, studies going around about the effectiveness of these things. And like I said, most of the veterans that I talked to gave really positive feedback as it relates to some of the equine pet therapies that I've been involved with or seen in person. And then, there's service pets. Well, often it takes a decent amount of time to obtain a service pet. It can be a lengthy process. There are some organizations that sort of offer a step below that can provide highly trained companion animals to meet individual needs as well. So those things are out there. Some of those programs, Pets for Vets, Canines for Warriors, Paws for Purple Hearts, Warrior Canine Connection. There's tons of them out there. And I'm sure you can get access or connected to them through your local VAs and your social workers that you work with. But I just want to let you know that essentially there's tons of different therapies or programs out there that are non-traditional that can help you supplement your traditional, mental health services and sort of help you along that journey of transition to find purpose and resiliency as well. And the last one is, this is how to connect to Syracuse Serve. So if you're interested in any of these programs, or if you just want to get additional information on any programs, like I said, your VA is a great place to start. But if you want to get connected here, you have the ability to at Syracuse Serves. It's essentially pretty simple. Just go down and on the right, you click on the link on the left, it'll take you to the page on the right, and then click community service and just write a little message in terms of what you're trying to get connected to. And either I or the program coordinator, Juliet, can work with you to get connected to any of these programs that we talked about today.
Awesome. Well, thank you all so much for providing these great insights and impactful resources. Really appreciate it. I do want to take some time to progress into a brief Q&A session. If anyone has any questions, feel free to pop them into the chat. We'll sort through them, but we do have a couple submitted questions. And I think these can be for anyone or any one of the speakers. So first one is, how does a veteran navigate the large number of service providers for mental health to find the right one? What are your recommendations?
As I mentioned before, the great place to start is your VA. They're going to be they're going to be the most familiar of any different alternative or different therapies or different programs or mental health providers that are in your network. They're going to be knowledgeable of them all. I'm sure they've all worked with them. And like I said, my history is care coordination. If you are in one of those areas that has a care coordination provider, you're going to get essentially pretty concierge type care, helping you navigate whatever resources that you're looking for.
Awesome. Thanks, Erin. Want to also point it to Stephen and Caitlin if you have any other insights. If not, we can jump to the next question. All right. So the next question we have is, what are your recommendations for veterans building a supportive community around them? What have you seen to be impactful in that regard?
I can speak to that a little bit. I think purpose is at the foundation of it. Especially, I work a lot with Fort Drum because I'm up in Watertown in one of our community-based outpatient clinics. So I think, especially with transitioning service members, right? Oftentimes our service members go into the military with that sense of purpose, that sense to serve their country, right? And when they separate, sometimes very abruptly, that purpose goes away, right? And the trajectory of their life may look different. And so trying to rebuild that purpose is super, super important. It's also a large protective factor for mental health and suicide. So I think that's just my 2 cents.
Awesome. Thanks so much, Caitlin, for that. Stephen, Erin, if you have anything you want to fill in, definitely feel free.
I thought Caitlin put it pretty well there. That's what we find, a sense of purpose, sometimes connecting them. I think just having veterans and service members connect to someone, just to leave a name and number with someone, just feel that they can reach out to an organization or a friend or something. But we at the Vet Center, and I'm going to keep my video off, I'm afraid. Can you guys hear me all right?
Mm-hmm.
All right. We at the Vet Center, we're often people when they separate from the military. One of the new programs we do, we get their information. Anyone who separates from the military, regardless of their eligibility for Vet Center services, VA services, anything like that, we contact them when they get out, and just give them sometimes they don't even want to talk, but just leave our name, number, just hold on to my name, my number. If something comes up, even if it sounds silly or you're not sure who to direct it at, just give us a call. And that's been pretty helpful.
Awesome.
Yeah, I'll echo some of those sentiments as well. I think a key part of it is doing like a self landscape of yourself. What is it that you like to do, what you want to get involved in, and then find opportunities to do that. For me, it was Team RWB and connecting through sports. I realized that's how I best networked with people, and sort of just doing that self-inventory of how do you best connect with people around you. And then, you have to put yourself out there. And like I said, I like what David said there, is volunteering and mentoring are good ways to find purpose and camaraderie. But, just finding the best ways that you connect and enroll with that.
Awesome. Thank you all. I think one of the last questions here, it's about group therapy. So from your perspective, what are the benefits of group therapy for veterans?
Well, I think we've already touched on that a little bit, right? That camaraderie, right? That is super important, especially when we're talking about protective factors and therapy in general. I think also there's a lot of benefits to being able to share experiences and being able to relate and have that connectedness with individuals, veterans who may have similar experiences or similar trauma as we do, right? So I think that's super important.
Awesome. Thanks, Caitlin. So I do want to move on to our last question here, and this could be for all three of you. Are there any last insights you want to leave with the audience? Anything that has been impactful to you throughout, like Caitlin, from like the provider perspective, your journey in supporting veterans, their goals within mental health, or even, from the veteran perspective, anything you want to leave to the audience?
Sure, I can speak to that. I think for me, sometimes our veterans, people in general, we all have stress, we all have things going on. We're all experiencing different things in life. And I think we discredit how much just validation and sitting with someone in that suck can go a long way. And that follow up and just knowing a lot of our veterans don't have that connectedness, that support. Some are very isolated. And so just being there and giving them the space to talk about what they want to talk about can go a really long way.
Exactly. Thank you, Caitlin. Oh, go ahead, Erin.
Well, you go. Oh, okay. Okay. The only thing I would say is that if something doesn't work the first time, it's not the only way to help meet whatever needs you're going through. There are tons of different alternative and different forms of way to to get to where you're going. So I wouldn't, if one thing didn't work, I wouldn't roll out the whole process at all. Just stay resilient. Go on to something else. It takes a while to find that different therapy or that different need that really helps you either connect with your community, build resiliency, or find a deeper understanding of yourself. You might not be one of the fortunate ones who can do that on the first try. So don't give up and continue to also search for different alternative things that may benefit you through your journey of, getting through your journey of transition.
Exactly. Thanks, Erin. Yep, there's so many resources out there. So as you both mentioned, taking the time to figure out what's right for you, sift through all the information and resources, very crucial. Stephen, sorry, don't want to leave you out. So if you have any insights you want to share, go right ahead.
No, that's exactly what what Erin was just saying. One of the things I do tell people when they come in for services, maybe their first appointment, is you might not hit it off. You might but feel free to talk to that therapist or talk to someone else in the staff and say, hey, it's just not working. But it's every one of our therapists have been fired by someone, so it's quite normal. And just we're here for them and not for our egos.
Right. Thanks so much, Stephen. So Michael, I do see, sorry about that. I see your hand up. So want to make sure I pass it over to you too.
Can you guys hear me now?
Yep. Mhm.
Okay, great. Well, Erin, thank you. Stephen, thank you. And I believe it's Caitlin, correct? Thank you very much for your guys' presentations. That's nice. For you veterans out there, please, my fellow comrades, toughen up, swallow your pride a little bit, and go get mental health if you need it. I waited way too long before I went and seen some help, and did a lot more damage to myself than probably what I could have. I just would have stepped into a counseling office. But anyways, besides that point, you guys, I wanted to talk to Erin and Stephen and Caitlin. I started an organization called TMC, the Military Club, but it's attached to a medical network, and I'm developing their veterans programs. We have small medical clinics from Arizona to Florida, and they don't have a veterans program. So I was detached for that to start that in September. And it's a great medical company. They're big. So I'm finding it hard to develop this veterans program for them because of resources. And we don't have enough resources. We have a great mental health department. But to get out there and connect with those veterans, it's hard. So I don't know if you guys have any suggestions on that. I don't want you guys to answer here because it's more business than what directed towards what you guys are talking about. But if you guys want to shoot me a text or email or phone call, I'll put my info down here in the bottom. And I want to be able to start connecting these little clinics out in the middle of nowhere to local veterans and start helping them get on track to their one of the 5 major health factors in somebody's life, and that's mental health. So I want if you guys could help me out with that. I'm lost on that. I just started in September, so I don't even know really where to look for resources for these programs. So
Mike-
Thanks for that, Michael.
Oh.
And as someone with extensive experience putting together care coordination networks, if you put your email in there, I'll reach out and we can talk about it.
Yeah, Michael, I posted my email in the chat. Feel free to reach out. There's a community engagement partnership coordinator in every VA medical center across the nation. So I'm happy to get you those points of contact. Whatever VA medical centers you need to get connected with.
Thank you. Thank you, Michael, for sharing your story and then what you're trying to do within mental health, and that's so amazing. So thank you for sharing. We appreciate it. Also, just want to extend a heartfelt thank you to Caitlin Treadway, Stephen Lockwood, Aaron Melius for sharing all of these valuable insights and resources. As they mentioned, don't be afraid to reach out if you need to get connected. After this VetNet, we will be sharing, the slides, the links within it, and then also just information on how to tap into these resources. So don't be afraid to reach out. What I also want to put in the chat is if you are an IVMF graduate, you can definitely reach out to us with any questions you have. We'll help you with additional resource navigation. But overall, I just want to extend a thank you to everyone who joined this webinar. Like I said, any questions, feel free to reach out to us. But thank you all again for sharing these resources and insights. We really appreciate it. So everyone have a great afternoon, and just look out for that follow-up email with additional information.